Some of the leaders in the legislative judiciary world, the chairs of the Senate and House Committee, Rep. Sanchez, the former chair, Senator Manning, who chairs our Ways and Means Subcommittee on Public Safety, and I've been involved in reentry, creating career pathways for adults upon release. We started talking to one another and thinking about how can we help the governor by using our work as legislators to help put a reasonable, careful plan together. And that is what we have done here. We came up with a plan that I think you all have, that you have all seen, that looks at three different groups of adults in custody. First of all, those who are really most at risk because of medical issues that they have. People who have serious kidney problems or heart problems or other very serious issues who, if they catch the virus, they are going to be in serious condition. And many of them already have had to be quarantined, which is putting a real pressure on the facilities. So that is a group that we believe should be released as soon as they have housing and appropriate medical care available to them. The second group, Group B, are those who are very close to their release dates. They're within 4 to 6 months of their release. Group B is a group that already has identified housing awaiting them, so they can move right into post-prison supervision upon release. Group C are also those who are near the end of their terms. They're within 4 to 6 months of release, and they are awaiting housing. And as soon as they have housing, we would like the governor to consider releasing them. Each of these releases would be done on a case-by-case basis. They would not be available to those who committed serious person crimes, violent acts that they are serving time for. And they need to have a clean record while they're inside. You'll see that we also did put a number of other conditions that we think are really important. First of all, the steps that the Department of Corrections has already taken to contain the virus, those all need to persevere, even as the outside world is reopening. Because we believe that as the outside world reopens, paradoxically, things become more dangerous for those who are on the inside, because it'll be easier for the virus to get inside and then take off. We want to make sure that when adults in custody are released, that there is appropriate notification for the victims of their crimes, the survivors. We need a serious outreach effort for them. We need to make sure that they are COVID-free upon release. So we have recommendations around that, and a couple of other recommendations as well. We were gratified to see that the governor is going forward with the first of our recommendations, that dealing with those who are most at risk for medical reasons from the virus. And we think that that is really important, and we really commend her for that. We do believe, though, that we need to look at decompressing our prisons because COVID remains a problem for everyone, and it is likely going to become an even bigger problem in the fall. So that is the proposal that we came up with, and we are, encouraging that the governor look at it seriously and that a conversation begin around it, because I think this is a really important issue, not only for those inside, but for their families, for the workers, and for the community at large. So with that, we'd like to open it up to questions and answers for you. A couple of our members need to leave at 11:30, so we'd like to just jump right into Q&A from you, members of the media.
Senator, this is Noelle Crombie with the Oregonian. Good morning. I joined slightly late due to some technical problems. I wonder if you could address, so forgive me if I'm asking a question that you have already answered. Can you address the timeline for these releases? When would you like to see these begin?
Well, we would like to see them begin, for those who are medically vulnerable, we'd like to see them begin as soon as they've been identified and there is appropriate housing for them, and we can be sure that they have medical care waiting for them. And, let me stress, this is not just opening the doors. The governor will be considering each of these on a case-by-case basis, and no one will leave the facility until we're sure that they, that they will be safe, that the community will be safe, that their medical needs will be taken care of. And if any of my colleagues, Senator Brzezinski, if you would get off mute. Looks like you want to say something.
Sorry. Yeah, I was going to say, Noelle, if you look at the proposal, we have specific criteria that must be met. And as Senator Denbrough said, this is not, as we saw in some states, opening the doors and letting anyone and everyone out. We feel that it's very prudent for us to come forward with the proposal that's there, that does have the safeguards for everyone involved, inside and out, and ensuring that there's a transition for these individuals that are released, that they actually have the support they need when they get out. What we don't need is have individuals coming into communities without having housing or the support they need for medical needs or for any other needs that they need to go through the transition. So that means also that the community corrections are also in place and available to assist and transition them back in the community.
So I just saw a question come from Michael Desmond, I think, just wondering about the number of adults in custody who could potentially be released. The proposal does include projected numbers. These are numbers that we received from DOC a couple of weeks ago, I think. And, I will say that, this is kind of a moving target. Dates change, people's release, proximity to release change, but you can find them there on that list, in the proposal. We believe that for that vulnerable group, at this point, we're looking at 123 adults in custody.
I'll just go ahead and jump in if it's okay. Maggie Vespa with KGW here. Looking at the numbers and the criteria, and please correct me if I'm wrong, it looks like Governor Brown may have pulled some criteria from Group A and some from Group B regarding housing plans. Did she stick specifically with Group A as you designed it, or did she kind of take the plan under consideration as far as you know, and then make her recommendations with it in mind, but make some adjustments to it? We're having trouble figuring out how much she stuck with the criteria you laid out.
Yeah, I think her proposal is very similar to what we're proposing. That is that those individuals would be considered, but they would not be released until we're sure that they have, until there's housing, until there's appropriate medical care. Rep. Bynum, you want to add something about this group?
Thank you. I actually think you should ask the governor what her thinking was in blending the two groups. I think we were very clear, but we also knew that we weren't insisting that she go Group A, Group B, Group C. It was clearly up to her judgment. She's the one with the final word.
And this is Floyd Brzezinski. I think I can follow up with that. As you can tell, she directed last Friday, Director Peters of the Department of Corrections, to start putting these together. So I expect, based on what we have received from the Department of Corrections while we worked on our proposal, they will be fine-tuning it as to the number count and also those who are actually available. Remember the criteria, you may have a person within that special population. That's only one component. All of the other safeguards and requirements need to be met before that person can be released. This sets up for the governor to have, as Senator Dimbro has said, a case-by-case review and analysis of each individual prior to them being released. We do not expect to see a significant number, quote unquote, walking out the door immediately, meaning in the next 24, 30, 72 hours. This will take some time for these to be reviewed, but we feel that this is the prudent and appropriate way to go forward to ensure safety and confidence in the community as well.
One more point I wanted to make was that we thought Multnomah County would be opening up, and it is not as of now. And the governor's put on hold transition applications for future counties. So I think that also will play into it as well. I don't have the detailed data of where the AICs would go back to, but I would assume that a significant number would have family in Multnomah County. So that's another wrinkle in the plan as well.
Yes, Noel. No.
And yes, and again, this may be something you've addressed in your handout and this morning, but I just wanted to be clear. So, to what extent will Measure 11 offenders be included in this group, if at all, and also people accused of violent crime?
Yeah. No.
And again, my apologies if you've gone over this, Senator.
Right, yeah, and it is in the proposal, Noel, that this does not apply to those who've committed violent crimes or are Measure 11, have been sentenced for Measure 11 crimes.
Maggie Vespa with KGW again, kind of speaking to that, we have a couple instances where people have reached out to us since this kind of became a conversation and said, you know, the person who, in one case, for instance, abused me for years, this woman was a child and she's now an adult, she said pleaded down. So what happened to her remains, but the charges maybe don't reflect that. And so she's wondering, would she have been notified if the man who is in prison for abusing her is of the group? Should she know already, or is that potentially coming? And then just your thoughts, you know, response to those in general who have concerns similar, that maybe there was a plea and they're concerned that, you know, the person who committed this crime and victimized them is not even getting the punishment that everybody sort of agreed to during that process.
So this is Floyd Brzezinski. Let me start off with that. The reality is there's a demarcation when we say our Measure 11 offenders are not included. Most of those individuals that may have had something in the way of a negotiated plea, quote unquote, down, are still convicted of significant person crimes. That is going to be part of the element for the review by the governor. Again, remember, this is a case-by-case basis. She has the ability to say yes to one versus no to another, and they will be taken in, I would assume, a lot of other information besides what we've put into the proposal as to determining as to what is appropriate and necessary. Realize also that all of these individuals, I believe, have to have served at least 50% of their sentence to even be considered. But that in itself doesn't mean that they automatically have an exit plan. The governor, again, has the authority and will exercise that authority on a case-by-case basis. So I expect those things to be taken care of. Regarding notification, the notification that we have looked at would be based on the individual making the criteria and the governor making the decision that the individual is going to be released, again, on a case-by-case basis. And then as we see currently use of the VINE system and others, the notification would go out to the victims of those situations.
Yeah, and let me just reiterate that, you know, the aside from that group that is, you know, are really medically fragile, you know, in Group A, the Group B and Group C are all very close to their release dates, and you know, those, you know, who are the survivors of their offenses know that they're coming out, you know, soon. And so that this, you know, this is something, it's obviously it's a difficult situation, but it's one that we want to do everything we can to prepare them for.
So, Senator, is it it's safe to say that that you and your colleagues did not feel the governor went far enough on Friday with her proposal regarding potential commutations? What have your conversations been like with the governor about broadening that to include the groups that you've outlined today?
So Nola, I want to step in on this because the bottom line is we've been working with the governor and the governor's staff for over, I'm going to say close to a month, as well as the Department of Corrections. We are not at opposite ends. We provided this proposal to her. She got back to us and said this is where she wanted to start. We stated that we thought it was imperative that we get this information out. As you know, we have a special session that's going to be called pretty quickly, and we think it's very important for all of our colleagues to understand the ramifications of the situation we find ourselves in with the Department of Corrections and COVID. So this is another means to get this out. And this is what we think is on a long-range plan. As Senator Dembro has said, we already know that we're going to have another wave come in the fall. We need to be planning now. And since we have such strict criteria before someone can be released, including housing, the support of the community corrections, we felt it was imperative to get this information out as soon as possible. We are not in conflict with the governor. We are working side by side with her and her staff.
So is it your sense, Senator, that the governor will support this, the criteria for release that you've outlined?
I would say, based on our most recent conversations with her, she is taking a judicious approach of step by step. She acknowledged all of the different groups that we had identified as ones that she felt were ones that would she would be willing to look at, again, on a case-by-case basis. So I have I think a lot of support, not support, I shouldn't say that, confidence in her moving forward in some of these other areas once we get through this first wave. As you can imagine, the other area that we have not touched on today is budgets. Because of the scenario that we find ourselves in, the governor had to call for across-the-board cuts in all agencies and departments of 17%. We know that the Department of Corrections have had a shortfall that we were in the process of correcting during the 2020 session. And so we have still other issues that are going to, I think, make it imperative for us to continue to look at how we can ease these issues on budgets across all agencies, and ensuring in this particular case that if we take these type of steps, that they're taken judiciously, case by case, and ensuring safety for all.
And let me add that I think you know, we believe that when this plan gets out and is examined, it's going to get a lot of support. A lot of people are going to see this is very reasonable. You know, we believe that a number of civil rights organizations will be supportive of this. Many people throughout the state will see that, you know, this really is a reasonable, prudent way to address this risk. So we're looking forward to that.
Speaking of budgets, is it your understanding, do you think counties are able to follow up with AICs as they leave prison, be it through parole or other means? In other words, are they ready for this influx since they're struggling budget-wise as well?
I guess I'm going to submit that they already know that many of these individuals, as Senator Dembro said, in Group B and C, are already charted to be coming out. As you know, we will not be able to keep them in prison beyond their official release date. Yes, some of these individuals will be coming out early, but it's only within a few months. But we also recognized, and we put into the criteria, that there is the ability to have the supervision at the local level. So we feel that the numbers that are going to be influxing into a particular county will be ones that they can absorb in a systematic way, and it will not put a burden on them. As Representative Bynum did mention, with Multnomah County being put on hold, they having probably the largest population of adults in custody that would be returning to their counties. That will be another issue as we get further down the road. And again, I believe that the governor has the authority, and she can and will exercise it on a case-by-case basis, that if a county is not able to do what they need to do in the supervision and provisions for these individuals, that will be taken into consideration before she would commute their sentence.
Right. And let me also add that, I'm sorry. Janelle, were you going to say something? No. We do see this as part of the state's overall corona response. And, we are looking into, I think you'll see one of the considerations that we have in the report is to look at using federal coronavirus response dollars to help the counties, if this does result in more work for them. This is very much part of what we as a state are doing to address this challenge of coronavirus.
How many of the people that have been identified in the report that you've produced are at Oregon State Penitentiary, where the state is dealing with its largest workplace outbreak? How will this affect the situation that is ongoing there?
I don't think we know that. We don't have the facility by facility breakdown. That's a good question for DOC.
All right, folks, we have just a few minutes left. So final questions from the group.
Sure, I had one more question. Maggie Vester from KGW again, just looking at the decompression strategy, I think it was the second paragraph had something akin to the inevitable has happened, pointing to infection rates and deaths in custody. And we were talking on our editorial call this morning, this governor and state leaders have been such champions of listening to scientists. And we went into shutdowns county by county, trying to prevent infection rates from spiking. And I'm just curious, anyone's thoughts on whether this came soon enough, that it sort of waited until the inevitable did happen, which scientists and advocates warned alike was coming, before the governor took this step and this plan was released. And now we're having this conversation now that these predictions are coming true. So just anyone's thoughts on whether this came early enough?
Floyd Brzezinski, I'm going to say, I think that's really a good question for the governor directly. What I will say is that I think that she has been doing everything she can, woman's work around COVID-19 for the state as a whole. This is one component of it. And yes, I recognize that there's been a number of individual advocates who have been calling for this maybe sooner than it's happening. But the reality, it's happening now, and we should be moving forward with this plan. And we hope that we'll see that being championed by all, and not looking back in the second guessing of when it should have happened or could have happened. The bottom line, it's happening now, and we should move forward.
Can I ask a question before we go? I wondered if lawmakers feel that the Department of Corrections has done enough to address the threat of COVID for those who will remain in prison.
Well, I'm going to follow up on this. I've got it 11:30. The reality is, part of the issue that we're dealing with is social distancing. Our prisons, most of them are not built for social distancing. That is why we think this is very important for the plan and the proposals to go forward to try to ensure. I personally believe the Department of Corrections has done everything that they could do within their bandwidth for what we're dealing with. And they've been extremely transparent. They've had a website up with all of the new information. There's a lot of quote unquote rumor that went through that just turned out to be false. So I personally have been very pleased with the the performance of the Department of Corrections and that work. So with that, I'm apologize. I have another 11:30 I have to get on, and I'm going to go ahead and excuse myself from this meeting. Thank you.
Okay, thanks, Chair Przanski. Yeah. Yes, I would agree with Chair Przanski that DOC really has done yeoman's work here. But we've seen, what happens when this disease gets into a facility. And, we think that what we're proposing here is going to make their job easier. And, that's what we're committed to doing. Chair Bynum.
I've been encouraging, when we were having hearings, I've been encouraging families of people who have AICs in our facilities to reach out to us to let us know if there are instances where they don't feel like they're getting the care that they need, or if circumstances start to feel uncomfortable. One of the concerns that I had was access to testing and making sure that people felt like they could get a test when they needed to. We know, I think it's OHA has issued guidance for people of color to be able to have unfettered access to testing. So I wanted to make sure that that was available in the facilities as well. It does not seem to be, but that is important to me. And then the other thing is making sure that if people are found to have an active infection or virus, that there is no negative consequence, because the consequence of not reporting an illness means that everyone else around you becomes subject to the virus as well. So it's making sure that we have our ears to the ground in the facilities, and that we're getting good information that is corroborated both from DOC, from workers, and from AICs and their families.
That's a great point.
Senator Golden had his hand up.
Yeah, I wanted to.
Not you, Dimbro. Golden.
No, but I did want to introduce him. That we also have Senator Golden with us, who's on mute. And Senator Golden, represents a district down in Southern Oregon. He's a former county commissioner down there and has a real interest in this issue as well.
Well, I will take a minute. I was actually waving goodbye to Chair Przanski, but I won't turn it down. I just like to make the point that this issue is of great concern all over the state. I'm quite a ways from the metro area, and I hear from constituents. I originally got concerned hearing from a couple of constituents with AICs with some real health challenges that would be very difficult, and started talking to the governor's office and Department of Corrections, and learned more about what life is like in those institutions. And I'm really pleased that this group who's taken the lead has developed the proposal that they have. And I'm just hoping that people who might, first instinct might be, well, we do not want our inmates released early. That's not what we do in Oregon. Really take a few moments to look at this proposal and how much thought went in it to prevent any increased hazard to public safety, to make sure that people had someplace to go and wouldn't be a burden to their communities, and to weigh that against what we've seen in many other states and the density and the difficulty with distancing in these institutions. And really, this is a balancing act, and ask themselves, where does common sense take us? And I really think this is a really well thought out sequential approach that lets us kind of measure how this goes as we go, and that we run the risk of just being terribly sorry we didn't proceed with this in a very few months. And I think and hope the governor sees it the same way.
Okay. I think that's a great way to end. Thank you all again for joining us. Amanda, any last words from a logistical point of view?
No, we had the audio or the video recording, so if anyone needs that after the fact, just reach out to me. Otherwise, any final comments from senators and representatives before we close out?
No.
All right.
Okay, stay safe.
Thank you.
Bye, everyone.